help with all the aches and pains. I've had women call me because their baby is breech. I'm not actually flipping the baby, but if you loosen up the pelvis and the sacrum and kind of get the round ligaments to relax, you can help that baby have as much space in the stomach as possible. So those are just a few of the big reasons why a lot of women come and see me. Before they're even pregnant. Absolutely, and I have people ask me all the time why a baby needs to get adjusted, but if you think about what that baby's first experience in life was, it was getting pushed through a hole that is way too small for them. And just think about the contractions and the muscles in the mom that are what they're doing to the baby, and not even the birthing process, but the position of the baby through those 9 months that they're in the mother's womb. I have seen a ton of kids that have latch issues because they have cervical problems or neck problems. A lot of torticollis that pops up because of neck issues, or even laying in the crib, and if they hold their head in a certain position. Colic issues. I help babies poop on a regular basis, which is really awesome to get those text messages that their baby pooped 3 times since I saw them. So torticollis is just a tightening of one of the neck muscles. Typically it's your SCM, your sternocleidomastoid muscle, and it just gets really tight. So then that's when you see a baby or a person whose head is kind of stuck like this. It's hard to tell somebody exactly how many times because everybody's so different. If you come to me with a disc issue, we're probably going to be seeing you a lot more frequently at first. And then if you come to me as a pregnant woman, we're going to see each other a little bit more frequently at first, unless you have some problem like the baby doesn't want to come out to the world yet. It doesn't want to be head down. We're going to be seeing each other a little bit more frequently. Otherwise, my goal in my practice is to not see you every week. It should never hurt. If it does hurt, I always tell patients to tell me to stop, and then we figure out a different way. But it should never hurt. Typically after your first adjustment, you're gonna be a little bit sore, but it's gonna be like you haven't been to the gym in a while. All right, so her left leg is shorter than her right leg. That's telling me that her pelvis has gone posterior and inferior. So it's come back toward me, down toward her feet. Her right leg is longer. So, do you feel the restriction on that right leg? Mm-hmm. That's telling me that her sacrum has rotated posteriorly on this right side. So we're gonna adjust it. Pressure here and right here. Good. This side has gone anterior and superior, so up toward her head and toward her belly. And now I do that. Give yourself a nice big hug. I'm gonna stack these elbows on top of one another, just so you hurt me and not live. All right, so take a deep breath in. Blow it out. Good. And deep breath in. And blow it out. Good. Now we're gonna adjust her neck, which she, if it's okay to share, was really iffy about neck adjusting. And I know a lot of people are, but you're okay with it now. So we're just looking for a limited range of motion. So we take her to lockout, about right there, and we just want a little bit more. There we go. So your neck is going to be really rotated, okay?